Arizona's aging population is increasing demand for in-home care, but providers say that staffing and funding haven't kept pace with rising needs and costs. Joining me now is Sara Wilson, CEO of Home Assist Health, a home care service provider. Welcome to Arizona Horizon. Good to have you here.
Thank you. Glad to be here.
Home Assist Health is a provider similar to others. Talk to us about that.
Yeah, so Home Assist Health provides direct care services to individuals living with complications of aging and physical disabilities. We do services in the home, and it includes providing for what we call activities of daily living, allowing folks to stay in place where they choose for as long as they choose, and intact with their family and friends.
So with that in mind, what is the state of caregiving in Arizona right now?
It is definitely stressed. We are dealing with a severe crisis in workforce supply. By 2030, we're expected to need more than 190,000 additional caregivers to meet the growing need in Arizona.
And that is because the growing need is a growing population, but lots of older folks, huh?
Yes. We have a rapid growth in aging adults, and we also have to recognize that there are quite a few older adults are on the younger side, but they're living with complications of chronic disease and new physical disabilities that does require additional support on a day-to-day basis.
How does funding for these services work?
So there's multiple pathways to access funding. Predominantly, it's funded through a Medicaid benefit called long-term care services, and we look at that as home and community-based services. So these services come into your home. You get a care professional or a direct care worker going alongside with you all day long, one-to-one, helping you with meal prep, feeding, self-care, errands, just so that you can stay home for as long as possible.
The funding for those services, the funding for that program, is it where it always has been? Has it been cut? What are you seeing out there?
We have not been adequately funded for years. A 2023 survey was done by Mercer, and the Mercer study found that we were underfunded by $30 million. That was in 2023. We have not received additional funding from our state legislature since then. So currently, we are underfunded by $6, and we're struggling just to make minimum wage.
What does that mean in the real world as far as staffing challenges and these sorts of things?
When you're looking at your budget on a day-to-day basis and you may really want to do a job like this, but you have to pay your bills, you're going to be forced to choose a job somewhere else other than caregiving. And we desperately need this workforce because providing care in home is the least restrictive and the most affordable option.
Are you losing candidates because of this?
Yes, we are, every day.
We were talking about again, but some folks with disabilities, that's also covered here. And that again, you need folks for you need trained folks for this.
Yes, the training is essential. We train folks on not just how to assist in activities of daily living, but fall preventions, how to avoid an unnecessary hospitalizations through reminders of health management needs and skills, medication reminders, appointments, essential things that keep people at home, and avoiding unnecessary hospitalizations.
And you're talking about keeping people at home, unnecessary hospitalization. Talk about the importance, especially of folks that are aging and that want to stay home. If some folks don't want to stay home, I want to get out of there as quick as possible. But those who want to stay home, talk about how important it is to let them stay at home.
It's amazing. Not only does caregiving help provide those daily needs and health needs, but it brings you companionship. It gives you a sense of something to look forward to on a day-to-day basis, especially if your family is living far away. And it also gives your family member a sense of peace. Maybe a relative can go back to work because they have a skilled, trained professional with their loved one.
And it also cuts costs. I mean, it's not cheap to be, going to some of these care facilities.
Correct. It's more expensive. Some studies say it's actually $40,000 cheaper per individual to stay home than go into a facility.
All right, what needs to change as far as public policy is concerned?
We actually have a bill right now at the state. We're requesting $2.5 million for one-time funding to help provide additional funding to our workforce. This will go directly to the direct care workers. So we're asking anybody that sees this, please, write a letter to your state representative or your state senator and encourage them to help support this funding.
And other caregivers around the state, I'm sure they would agree with your position.
Yes, most definitely.
Are there any differing opinions? Are there any way of people looking for public-private partnerships, these sorts of things?
We are so fortunate. We even have support for this funding on both sides of the party. Both the GOP and the Democrat are supportive of this funding ask.
That in mind, though, that the funding hasn't been happening.
Correct.
And we're still short.
Correct.
What happens if that trend continues?
We will not have a direct care workforce to provide home and community-based services. You're going to see more people entering facility-based care, or you'll see, worsening outcomes that we really don't want to plan for.
The last question here, because we're talking about the growing population and the aging population. It's also a lot of people are moving here. There should be more people applying for these positions, should there not?
Yes, and there's a lot of work going on upskilling this workforce into career pathways, into nursing or to future doctors, where you start as a bedside manner working one-on-one with individuals in their home.
All right, Sara Wilson, Home Assist Health CEO. Good information. Thanks for joining us.
Thank you for having me.